Today I'll be giving you the information that you need on taking your medications at home. Your medication will come in a bag like so, with your name on the label. The medications have been prescribed for your use only. Please do not share them with anyone or take a medicine prescribed for someone else. They may seem similar, but they have different ingredients or could be a different dosage and be dangerous to use. Before you are discharged, your medications will be discussed with yourself by a pharmacist, a pharmacy technician, a doctor or a nurse. A supply of medications will be provided to you to last you until the course is finished or for at least 2 weeks if this is a medication you need to continue. In your discharge summary to your GP, information on the medicines you need and how to take these medications will be included. If you have some old medication at home, always check if you still need to take these before you leave hospital or check with your GP or practice nurse once you are home. How to take your medicines safely. Every medicine has a label containing your name, the name and dose of the medicine and how often to take this. If the medicine needs to be taken with or without food or has any other special instructions, for example, may cause drowsiness, this will also be on the label. With each medicine, there is a patient information leaflet inside the box or the packet. This states the purpose of the medicine, what conditions it is used to treat, with an explanation of the dosage and how to take the medicine. Any side effects that may occur and how often these have been noted to happen in other patients. If a medicine cannot be taken with a particular food, for example grapefruit or another medicine because of possible negative effect, that will also be described in the medicine's patient information leaflet. If a dose of the medicine is missed, too much is taken or too soon, advice on what to do next to stay safe is also contained in this leaflet. There is a lot of information on the leaflet, but if you have any questions, please ask before you leave hospital. If you are already home, please ask your pharmacist or GP at your local practice or speak to a pharmacist in the community. Getting more supplies of your medications. A copy of your discharge summary will be emailed to your GP, which will allow them to update your records and any repeat prescriptions. This will ensure that you don't run out of your medications and a further supply can be obtained from your pharmacy. There is a second copy of this summary information for you to take home. It's also useful for checking what medicines you need to take. Storing your medicines safely. Always keep your medicines out of reach of children or vulnerable adults. Medicines need to be kept cool and in the dark, not stored in a warm or sunny area. If a medicine needs to be kept in the fridge, this will be stated on the medication label. Keeping the medicine and patient information leaflet for each medicine in its original box or container ensures that the full instructions are always available for you. What do I need to know about side effects? Side effects are unwanted symptoms that happen after taking a medicine. These are included on the patient information leaflet and it will tell you how common these are. If you are unsure whether a symptom is related to your medicine, please seek advice from your GP or local pharmacist. Only stop taking a medicine if you are advised to do so by a doctor or other healthcare professional. There can be health consequences from stopping a medicine suddenly, or if you do not have an alternative medicine prescribed for you to take instead. Coming back to the hospital in an emergency or for a planned admission. If you need to come back into hospital at any time, please ensure that you bring your medications in their original boxes. Please also bring any creams, inhalers, insulin equipment or any other regularly prescribed items. This is to ensure that the doctors and nurses know what medication you are taking so that these can be prescribed and supplied to yourself in hospital. If you forget any of these items, it can be helpful for a relative or carer to bring these into hospital for you as soon as possible. Coming back to the hospital for an outpatient appointment. Please bring an up-to-date list, which could be a repeat prescription or a discharge summary to any appointment that you may have in outpatient settings. How can I get support with my medicines after I leave hospital? The instruction label on the bag of your take-home medicines contains a telephone number for the hospital's pharmacy department. This will connect you to our medicines information line. Once you are at home, your local pharmacy can provide you with support on how to take your medicines and any questions you may have. Your GP pharmacist will review your medications. This can happen more often if your medications are changed, otherwise it will be once a year. You can also seek advice from your local community pharmacist who may provide you with advice on any questions you might have about new medications. Please do not hesitate to seek advice from these professionals. Who can I speak to about any queries or concerns after I have left the hospital? You can call the Hospital Medicines Information Line on 01709 42 4126. Your local pharmacist can offer advice on any medications or answer any questions you might have. If you still need further advice, please do not hesitate to see your GP or local practice nurse.